Lung cancer can present silent symptoms that are often overlooked. Recognizing these subtle signs early is crucial for timely diagnosis.
See, basically, the silent symptoms means the routine symptoms we know: cough, blood in sputum, and the breathlessness, all those things. The less symptoms, the early symptoms which get unnoticed are silent symptoms. Those are the symptoms which usually patient don't notice. Sometimes the lower respiratory tract infections multiple times, and sometimes headache, or sometimes the clubbing of the fingers, anemia. These are some of the symptoms related to the lung cancer. Why it happens? Because so the lung cancer have a fewer nerve supplies, so that's the reason and in early tumors pain is not the symptoms. So most of the time pain happens when the disease spreads to other parts of the body. If the disease spreads to the bone, then automatically patient gets the back pain, bony pain. The pancreas tumor, the type of lung cancer where it involves the upper lobe of the lung and it erodes the ribs and vertebrae. So patient most of the time says the back pain. Sometimes you have a patient who had a paraneoplastic syndrome. That is a syndrome where in a lung cancer patient the tumor secretes some enzymes and hormones like the calcium, so the patient will have hypercalcemia, which causes headache, confusion, dizziness, and the cramps in the abdomen. These are some of the lung cancer. I have recently come across a young lady. She was 35 years and she presented with headache and blurring of vision, and then we did MRI didn't show anything. So the CSF was done, which shows malignant cells, and on evaluation we found she had a lung cancer and which has a leptomeningeal the metastasis. So these are some of the symptoms which get unnoticed, and that's the reason these are called silent symptoms of the lung cancer.
Early detection of lung cancer is possible through routine health checkups and screenings. Don't ignore subtle symptoms.
So I personally feel routine health checkup and screening are the important part to diagnose lung cancer early. As we have come across the situation of COVID. In COVID, so many people did a CT scan, and accidentally a few patients found a lung tumor, which was in an early stage. So, some way lung screening is one of the way to detect the cancers early. The second things, whatever symptoms you feel, either some of these silent symptoms like weight loss, bone pain, headache, convulsions, dizziness, abdominal cramps, recurrent lung infections, and then finger clubbing. So these are some of the symptoms. Automatically, you should meet the doctor and consult the doctor, get evaluated by routine check everything, and then you can consider whether the patient is suffering from lung cancer or not.
Lung cancer screening is crucial, especially for smokers. Early detection can save lives.
I think still in India we are lagging behind the screening for lung cancer, but I think we should do. The smokers who smoke more than 20 packs per year, so those are the persons who should start screening from 45-50 years of age. Every yearly, a low dose CT scan is recommended to check whether they are suffering or they are getting a lung cancer or not.